Well, joining me now with more is Democratic Congresswoman from Florida, Debbie Wasserman Schultz. Always a pleasure to have her with us. Congresswoman, thanks so much for being here.
Good to be with you, Megyn.
All right,
Thanks
so
for
let me ask you, because I had this exchange with Linda Douglas at the beginning of the show, and the viewers are going nuts on this. And, you know, in fairness to her, I didn't get direct answers to my questions, and I don't know why, but you're always straight with me. Can you help me understand? Help me understand why, when you look at the latest polls and you have 77% or 73% of the American people saying scrap this bill, why the Democrats don't come out and say, you know what, we hear you, we're going to scrap it. We're not giving up on health care, but we're going to scrap this because you don't like it.
Okay, I'm glad to give you a direct answer. And the last time I was with you, Megyn, I was not quite ready. I'm armed and ready, since I know you like polling data.
Good woman.
Last week's Newsweek poll, which took a look at the pieces of healthcare reform and asked 1,000 respondents how they felt about passing a bill that denies, that prohibits insurance companies from dropping you if you have a pre-existing condition. 76% support that. 81% in the same poll support an exchange, making sure that you can have the ability to comparison shop between plans. You have 59% that support making sure that you can't be denied coverage for when you're sick. So at the end of the day, and at the end of that poll, 48% of the people, when surveyed, versus 43%, said if there was a bill that had those components in it, they supported making sure that Congress passed it. Now, this is not about the president's personality. This is not about who is leading the charge here. This is about the American people caring about the components of healthcare reform and needing them to become law so that we can stabilize and make more secure insurance premiums, so we can cover the 47 million Americans that don't have health care, and we can bring overall costs down.
Okay,
so
and what you say is actually backed up by
the pieces of it.
What you say is actually backed up by our director of polling, Dana Blanton, who was just out here, who said when you tick off with American people, do you want premiums to go down? Do you want to be a coverage that won't deny you if you have a pre-existing condition? They say yes, yes, yes. But nonetheless, when you ask them how they feel about the current bill, they don't like it. And it seems what they seem to be saying, we want a lot of these components, but we don't like it in the form you've done it. And it could be because of the kickbacks and the special deals. I don't know why it is, but they clearly don't want it. So what's your response to those people when they say that back to you?
That's why this summit is important, because we need to make sure that we help people understand. And I'm not being patronizing here and saying, oh, the reason people oppose it is just that they don't understand it. But those component parts that I just went over, that whether it's Fox polling or Newsweek polling or any polling in between, shows the American people support, we need to make sure they understand that those things are in the bill. They're in the bill that the president rolled out on Monday, which combines the best ideas of the House and Senate Democratic bills that we've passed out of the House and Senate, and they're in the bills separately that have passed. So making sure that the 80%, and that's the purpose of this summit, making sure that the 80% of agreement that the Republicans say that we have on health care reform, and we can just hopefully negotiate over the 20%, that's what this summit is all about.
Why
Let's
can't
find
you
a
do
common
it?
ground,
Why
pass the bill with these
can't you do it
component parts in
piecemeal?
it.
Okay, so let's say you're right, and the American public, they want individual things. They want to be covered for their pre-existing conditions, for example. Why can't you do it piecemeal?
Can we stop just at that?
Yeah, sure, go ahead.
Hold on one second. Let's take just that piece. The reason that you can't, I would like nothing more than to, and I have advocated, let's go back to the drawing board, at least in the sense that we'll try to pass it in pieces. But the most popular reform is the one that you just described, prohibiting insurance companies from denying people based on a pre-existing condition, which, by the way, is not in the Republican plan. They only cover 3 million people. If you take let's say I file a bill tomorrow that just does that.
Right.
Unless we expand the pool and require people to have coverage, then you only will see insurance premiums rise from that reform.
Because it's going to cost the insurers some money.
Yeah, because it's going to cost them money. You have the same number of insureds, and all that's going to happen is insurance premiums go up.
What about, let me ask you about another one.
So we need to couple that with more people being covered.
Let me ask you about another one, because when you do the piecemeal analysis, and this is according to this latest poll, again, this is a CNN poll, they ask people about tort reform, and 66% of those asked said they favor limiting the amount of money that patients can get if they win a medical malpractice lawsuit. 66% want that, 33% don't want that. Why isn't that in any bill? Why can't there be agreement on tort reform?
Because well, they support that until it's them or their family member that is injured in a medical malpractice case.
But you can give them
the poll numbers change.
You just have to limit the non-economic damages. In other words, if the doctor cuts my arm off, I can get the money back for what life is like to live like without this arm, so that I can function. But you can't get punitive damages.
What all the studies show, any objective study you look at, the increase in costs attributed to medical malpractice cases and damages awarded in medical malpractice cases is about 2% of the overall cost of health care.
The CBO said 50 billion. 50 billion could be saved if there was meaningful tort reform.
But it's 2%. So that is not going to have money. Well, that particular fact I'm not familiar with, but I do know that in terms of a percentage of the overall cost of health care, damage awards in lawsuits, in medical malpractice lawsuits, is about 2%, which is not going.
But why not address it? Because Howard Dean, he came out and he said it's because of the tie between Democrats and the plaintiffs' trial bar. Is that true?
We should address tort reform, and the president wants to address tort reform and has talked about it. And that's why in our bill and even without the bill, the president has pushed the states to use their best practices in tort reform, because there are lots of other kinds of tort reform besides caps on damages.
I know, but
they're
wrapping me, Mayor. I just want to clear this up. Listen, this is what it actually says. The House bill, the Senate bill, and the president, they encourage states, they give grants to states that develop or implement alternatives to current tort litigation. Well, that's not real.
Neither is caps on damages. It doesn't do anything significant to bring costs down. If we want to talk tort reform, then let's examine the things that really do have an impact on costs. Caps on damages is just a nice whipping boy that everybody says we need to do, but is really not going to have any significant impact. And no state in the country that has caps on damages has seen a significant drop in costs, including my own state.
All right, that's so interesting. Listen, I appreciate you coming on. You always give straight answers, and I know my viewers appreciate it as well. Thanks so much.
Thanks so much. Great to be with you.
Congresswoman Debbie Wasserman Schultz of Florida. All the best to her.